Hi, I'm Dr. Kendrick Johnson at Ark Family Health, and I am just doing a quick video to explain what the mission of our company is for those of you who are interested in being a part of it. So I wanted to start off by looking at the environment that we're currently working in. We have what I call a sick care system, where the incentives of the healthcare system are not to make people healthier necessarily, but just to make money. And not that the people involved in our current healthcare or sick care system are wrong, but the system itself is not set up to give incentives to people for actually facilitating health and wellness. So how does that play out? In our current system, the insurance companies do not have any incentive to make people healthier, because they only get paid a percentage of the premiums that are actually paid out for care. So in order for them to make money, there has to be higher costs of healthcare. And the hospital systems, of course, they don't make more money by making people well. They make more money by people being sick and being in the hospital. And the doctor's offices, they also don't make more money by making people well. They need to bring people into the office, and so they can make money. And so none of these people in these systems are doing anything wrong. They're just in a system where there is no financial incentive to help people get healthier. And also in this system, there's a whole lot of people who just can't afford to get care, especially when all of the care is based around sickness. So there's no financial incentive to provide preventive services and to make people well, because all of the care is based on insurance-based practice covering for sickness. So I wanted to talk about what we're trying to do differently to get us somewhere else. And this is a cheesy drawing I made of this path towards what I call Planet Health and Happiness. Here on Planet Health and Happiness, it's a place where the system actually does facilitate health and happiness affordably to everybody who's in the service area of the system. So how do we get from the current system to Planet Health and Happiness? And this rocket ship is Ark Family Health. It's our company, and I've labeled it DPC, or Direct Primary Care, because that is the type of vehicle that we are using to get to this other type of system. There might be other types of model or practice models that would help with this, but we believe that direct primary care is the model that best aligns the doctors and the patient's incentives to help everybody get more healthy. So direct primary care just means that we don't bill insurance for anything. Again, as soon as you're in the insurance-based system, you no longer have an incentive to make people well, because the insurance doesn't have an incentive to make people well. So, so we've stepped out of the insurance-based medical system, and we charge a monthly membership for all of the office visits, procedures, in-office diagnostics that our patients need. So all of that's included in the monthly membership. And that way, we, as providers, we have an incentive for people to be well, because we don't want them to be coming into the office all the time. All of their office visits are included. And it also frees us up from all of that extra work that insurance companies introduce into the healthcare system. So now we don't have to spend half of our time, billing and coding, and we don't have to be chasing down insurance companies for the rest of our payments. And that gives us the ability to see a lot less patients. So in a normal family practice office, there will be somewhere around 2,500 to 10,000 patients per provider. And as you can imagine, it's pretty difficult for the average provider to take care of that many people. One study said that if you were to actually do all of the acute, chronic, and preventive care for that many people, you'd have to work 21.7 hours a day per doctor. So that, in my opinion, means that all doctors are set up for failure, because we're in a system that doesn't even close to give enough time just to do the minimum basic services, let alone even start to work on how to get people to Planet Health and Happiness, where their lifestyle is what enables them to actually be well. So in direct primary care, with the extra time that we have per patient, because we can see around a fifth of the amount of patients that I would in a normal practice, then I can spend more time talking about nutrition, exercise, emotional wellness, even spiritual wellness. So those types of things allow us to actually move people from getting care just when they're sick to preventing illness before it even starts, and helping people to have a sense of well-being. So direct primary care is the vehicle that we use, and then this path that we've drawn to Planet Health and Happiness is lifestyle medicine. Lifestyle medicine is the scientifically proven type of medicine that shows that when we use nutrition, exercise, emotional wellness, and avoiding harmful substances, we can prevent 90% of diseases. So, and we can even treat many of our most common chronic diseases. So when we are in the sick care system, we give medicines for diseases that change people's risk by 5 or 3%. Well, with lifestyle, people can modify their risk of heart disease and cancer and diabetes by 80%, 90%. But why is that not being used in our current system? It's because nobody has the incentive to do it. Nobody has the time to do it. And so that's why we believe that the whole system needed to be turned upside down, so there's a real incentive to actually help people get well. So lifestyle medicine just means that we talk to people about what they're eating. We talk to them about how to make lifestyle change. We follow up with them, and we provide support along the way. But most importantly, we go through the research to find what really makes a difference and what the science really says about what to eat and what to do. There's so much confusion in the media today about what we should be eating that sometimes you really need your doctor to say, no, all of that stuff is just media noise, and what you need to be focusing on is the basics of nutrition, the basics of exercise, and then provide some accountability for it. So that's our path, and that's what we're trying to accomplish. And our goal is that we can make this type of care available for everybody in the Phoenix area in the next 10 years. And right now we're providing it to just a few hundred people in town, but it's growing very quickly. And if we continue at our current rate of growth, we'll easily be able to meet that goal. So we're looking for people who can help us to accomplish that. People who really care about other people and want to make a difference. So if you're interested, please contact us and talk about how you can be a part of it. Thanks.